After several years of conducting research, publishing a number of papers talking about some of the challenges, later life consequences of former NFL players, such as depression and mild cognitive impairment, which is a precursor to Alzheimer's disease, we decided about 3 years ago, around 2012, that it was time to think about a clinical program that would not only study the incidence and prevalence of some of these conditions, but to begin to think about treatment programs.
So in terms of the goal of the program, our goal is to see, obviously, former or recently retired NFL players. Our goal is to improve their quality of life. And so we see them and try to develop a kind of baseline and see what their needs are. And then we provide kind of a structure and referral sources for them in their local community.
We've been building this team over the course of about 12 or 13 years, and really proud now to say that we have this amazing clinical team that's less focused right now on the research side of all of this, but really trying to be a game changer in making these former athletes better able to do the things that they wanted to do in retirement, because many of them are retired at a very young age, at age 35 or 40.
In the program you see a general medicine physician, a neurologist, a physiatrist who does a lot of the sports medicine and deals with some of the chronic pain and old injuries, a nutritionist, somebody who does neurocognitive testing, and life coaches, and we all coordinate, share our findings, our evaluations, our recommendations, and put all that together by the end of the visit and then summarize the visit.
The athletes typically are going from appointment to appointment. There is a significant level of coordination of care. So an athlete may see one clinician initially, and by the time they're in the room to see the next doctor, that doctor's been informed of any significant findings from the previous visit. We communicate pretty closely throughout the 2-day visit.
Before we leave, we have what we call a care coordination consultation at the end. We have at least one of our clinicians, as well as our clinical care coordinator and myself, come to this meeting. What we do is we kind of walk through your overall visit results, everything that we have over the 2 days, which is going to be most of it. We don't necessarily walk through it from a numbers perspective, but we really walk through what it means for your health, what it means for how you're functioning cognitively, physically, and emotionally right now, and what aspects that we think are strengths and what are areas for potential growth. And then we'll kind of walk through and answer any questions you and your spouse might have about what to do when you go home, how your information will be protected, and how your information will be used to help you work with us to formulate a plan to improve your quality of life, physically, psychologically, and emotionally. We also have one non-medical aspect of our component, which is our life skills or transition consultation. We work with the Bell Leadership Group here at UNC, who will provide information relative to all aspects of life.
The life skills section helps identify things that might be going on in the players' lives, whether it's professionally or in their family lives, financial situations that could have an impact on their health, whether it's through stress or making exercise or dietary decisions more difficult. So we work on identifying those areas that could be getting in the way and coming up with strategies and plans for building a healthier and more successful life overall.
And we are in constant communication. Even though we are frequently seeing patients at different physical sites, we are actually in constant contact. So it's a unique opportunity to provide a very patient-centered opportunity with lots of feedback and communication between different clinicians in really what is a unique opportunity for patients.
The most important thing to realize, especially for a retired athlete that's interested in coming to the program, is we take a very practical approach and really talk about practical things that you can do when you return home to a normal life. And really try and integrate a busy schedule, full-time job, and really try and make exercise and nutrition a priority. And it's really, really important for most of the guys we see. They're really on that verge of either going to pharmaceutical modes to influence things like diabetes, blood pressure, cholesterol, or really taking a healthy lifestyle approach to mitigate some of those things. So it's a really great opportunity to change your life for the long term.
And if we could step in and with life skills coaching and all the expertise that the rest of the clinicians on the team provide, help them move forward in that new direction, that makes their visit to UNC extremely worthwhile.
We really look forward to working with you. We have what we like to call a patient-centered program. Medical care sometimes isn't always fun or exciting. What I like to tell all the players that we work with is every aspect of our program that we can make as patient-friendly, as user-friendly and enjoyable as we can, we do. Some aspects like testing or sitting in an MRI machine can only be so exciting. But every aspect in and around those experiences, we're going to do the best to make this an enjoyable experience, a safe space, and in many cases even sort of a fun and enjoyable experience for you. We look forward to having you come visit us at UNC.